you have said recently that the virus that is coming back, COVID-19, is coming back in a more virulent state than it was before. So, what is the situation in Maryland? And are you talking to other governors, and are they saying they're also worried they might not have enough vaccines, PPE, and hospital beds?
Well, look, this is something we've all been dealing with for nearly 9 months now. And, as much as we'd all like to get back to our normal lives, the honest truth is that some of our darkest days are still ahead of us. The virus is spiking out of control all across the country. We're still in better shape than many states, but the virus does not recognize state borders, and it keeps coming back around and moving around the country. However, the good news is there is light at the end of the tunnel. Operation Warp Speed and the vaccine is really way ahead of schedule, and it's like the cavalry is coming to the rescue. It just is not going to happen as fast as we would like.
So, when the first wave of the virus came, the governors were supposed to be cooperating, and you were then the head of the National Governors Association, and you brought them together from time to time. But in the end, they were kind of competing a little bit for PPE and other things because they couldn't get tests, they couldn't get equipment. So you would anticipate that will happen now, that governors are going to fight each other to kind of sneak around and kind of get more vaccines than they otherwise are entitled to?
Well, this was kind of uncharted territory when we were at the beginning of this crisis back in the spring, and I was pretty frank about some of my concerns, about the lack of coordinated response in Washington, and it was kind of a mess. We were all building entire infrastructures from scratch, but the good news is we're miles ahead of where we were. Now I'm not critical of where we are. I think there's a really good cooperation between the federal government and all the states. They have a plan. No governors are going to be able to go around the back door and get vaccines without going through the process. Everybody's going to get them, and in the same pro rata manner, and each state has submitted plans to the CDC about how we're going to prioritize who gets them first, starting with our most vulnerable populations and our nursing homes and our frontline healthcare workers. And then as we get them, we kind of move down the list to the people that are most vulnerable.